Hi, my name is Uroosa. I'm from India. I've been living in Dubai for past 5 years. I gave birth at King's College London at Dubai Hills. I was introduced to Dr. Gowri by a friend. Her experience was excellent in terms with the care at the hospital and with Dr. Gowri. We proceeded with Dr. Gowri as well, and I cannot be thankful enough for the experience. So the first time I met Dr. Gowri, I was immediately put at ease. She made me so comfortable by answering all my queries and questions and doubts I had about the whole pregnancy. It was a beautiful experience to be pregnant. Though I had some complications. I had type 2 diabetes before I got pregnant as well, which is a high risk with the baby can weigh lower in the percentile, higher in the percentile, or stillbirth as well. I was highly scared with all of the experiences I had in past. When I chose Dr. Gowri and the team, they made sure they were measuring the growth of the baby. Every time telling me what to eat, what not to do. Also, along with the endocrinologist, they were monitoring my sugar levels. So in the end, we finally delivered our baby safely and healthy. Me and my husband were really pleased with how the procedure went so smooth. And the stitches, C-section stitches were done so clean and neat, you can hardly see anything. It's like a plastic surgeon working on me. I'm really happy about it, that I will be scar-free in no time. And the staff was so nice to us, always taking care of the baby and me in the recovery room till we went to our room, till the discharge. I cannot explain how beautiful was the whole experience. The best care I received post-delivery, especially I would like to mention here the nurse Franny. She was adorable. She was so helpful, motivated me so much to walk. She made me stand and walk after the C-section, which is the toughest part. Just holding me all the time. Under her care, I was feeling so secure and well taken care of. I would recommend this hospital to every expectant mother, be it a normal delivery or high risk. Especially, I would recommend Dr. Gowri and the team. They are so helpful, you'll be taken care of. So you will be answered all your questions and clear all your doubts. They have a lactation consultant afterwards, the midwives, the nurses, the doulas for the classes. Everyone will be so helpful. Before the delivery, prenatal care is excellent. The postpartum care is excellent. I would highly recommend King's Hospital London. In the end, I would like to thank Dr. Gowri and the team for the ultra care they have provided for us.
There are women who come in pregnancy who have pre-existing medical disorders, and that in itself is a different way of how we manage pregnancies. Uroosa had type 2 diabetes, and she was already on medication for her diabetes prior to pregnancy. Now, when you have a pre-existing medical disorder, that particular medical disorder can worsen and might need further treatment. So it has an effect on the mother as well as the baby. So when you have type 2 diabetes, or even for that matter type 1 diabetes prior to conceiving, it is very important to have a medical review or gynecologist review to optimize things prior to conception or prior to you getting pregnant. And once you're pregnant, you will need quite a lot of screening tests done throughout the pregnancy, and you will be deemed as a high-risk pregnancy. You will have your 3-month scan, your 5-month scan, where we look at certain conditions that can complicate pregnancy with diabetes. When Uroosa came to see me, she had her pre-existing diabetes, which meant a lot of extra education and a lot of extra care that she required. We obviously developed a beautiful relationship as a result of that. We saw each other quite frequently, which is because she needed more frequent scans and more frequent blood testing. The reason we had to go through a cesarean section was because she had a condition which meant she couldn't push. If she did, that would put her at risk. Uroosa had an elective cesarean section and delivered a beautiful, healthy little girl. It is very important when you do have a medical disorder or pre-existing medical disorder that, as an obstetrician, I work very closely with the physicians So Uroosa was being looked after by the endocrinologist as well as me, and we had to have that relationship. When do we change medication? The physicians would want to know how the baby's growing, and that feedback is very important in a successful outcome.